I'd like to tell you a little bit, well, brag a little bit about the level of care and service that we offer at our office, specifically with the chiropractic portion of our services. When you get adjusted here at HealthWorks, we are always looking at moving you in a direction toward health. So there are basically two different types of chiropractic care. One type of chiropractic care is about symptom management. So what that means is that you might come to the chiropractor with, say, a low back issue, like pain in your low back.
Right.
And that chiropractor will take care of what your issue is, needing a low back adjustment. You get that adjustment, you feel better, you feel great. That's perfect. That's what you wanted. And you leave the chiropractor just feeling great and go about your life. The other type of chiropractic care is the camp that we fall in as far as what we offer. And that is that we're looking at all of the underlying issues going on with your spine and your structure, your nervous system, and working toward healing those so that they are functioning at their absolute optimal.
So not only do you get the care where you feel great when you leave, but we're also making sure that your entire body functions optimally.
Yeah, I think of it a little bit like layering. So you don't just have one adjustment and you're done. You have one adjustment that builds on top of another adjustment on top of another adjustment as your body gets healthier and healthier and healthier. And that's a whole different mindset and a whole different way of going about looking at your spine to see what needs to be adjusted.
Yeah, simply not chasing symptoms around and using chiropractic as more of an aspirin, managing things. That's what our current state of what we call healthcare today is doing, just managing symptoms. How about being 100% healthy?
Yeah, I would love to be 100% healthy, as I'm sure you would too. And so we had an example about a patient that had been under that symptom type of chiropractic care for a long time.
Decades.
A few decades. She was getting exactly what she wanted because that was what she desired at that time, was some symptom management. But once she found out that there is another type of chiropractic care that looks at correction and healing long term, she decided that would be the best option for her healthcare going forward. And we want to show you something structurally that's pretty cool that was able to happen over the course of a year.
A little less than a year.
A little less than a year.
9 months.
And so just to give you a little bit of background about what we're talking about, when we look at the neck, the spine, in the neck we want to have a nice curve. Would you hand me that spine, Dr. Taylor? It's a little easier to see in 3D, so I want to show you before we look at the x-ray. So here's our spine, and we're going to have the spine face the same way as the x-ray. So they're looking at me. And in the spine, we should have some curves. And these curves offer strength and stability. It allows the nerve inside to lay relaxed inside of the protective bone. And it also makes sure that you're not prone to injury because that curve acts like a spring to transfer force so that when you're sitting or if you have a fall or an accident, that those nerves aren't damaged. And so sometimes what we see over time is that we can lose that curve, and that's called degeneration, or spinal degeneration. And part of what we're looking to do is always to make sure that we regain that curve for our patients. And so let's look at this lady's x-ray. This is really cool.
This is really neat. So what we have here is a side view of her neck. So her nose is on this end and the back of her head is right here. Why don't we zoom in just a little bit here so you can really see this. This is really cool. So when she first came in, you'll notice that there's some severe degenerative change here. See kind of these hook-like things going on right here? That's because her spine has been just pounding down on that area for decades. That's about 30 years, you would say. Whoops. There we go. About 30 years of degenerative change that's occurring there. And so what we did was we took the thought process of not only making sure that her body is functioning properly, but we also want to make sure that she's structurally proper as well. So what we did was we gave her a series of adjustments and some exercises to do as well. We do have, we do make sure home care is a big part of what we offer here as well. And over a period of about 9 months, what you'll notice now right here, you'll see 18.7 degrees. So optimally, about 35 to 45 degrees is where you want your curve to be for that optimal support. That's where your spine and all those nerves are happiest. So if we look down here at the next one, find where my cursor is. This right here. So what we see here is we see now she has a 30.7 degree curve. And what is actually happened here, not only have we changed the curve, but we've also taken the pressure off this already degenerated area. So essentially what we've done was we've taken the pressure off that area, and now we've hopefully halted that area of degenerative change, because degeneration is progressive in nature, and we actually helped halt that degenerative change. Now, she had to make her appointments. She had to do her home exercises. And so this is really a team effort. This is not something that just happens out of nowhere. This really is a team effort, and we are your cheerleaders along the way to make sure that this does happen.